I know everyone's probably ready to chat, and we promise we will give you time to do that. But this next speaker, I think, is going to give you a lot of information, and I definitely think it's worth your time listening. I hope you've been enjoying the morning. Has it been good? All right. Great. So our next speaker is Dr. Pallav Mehta. He is a medical oncologist at Cooper MD Anderson, which is right near where we're based in Philadelphia, but they're right across the river in Camden. And I've recently gotten to know Dr. Mehta, and he has been doing a lot of important work for Living Beyond Breast Cancer, and he will be joining our board, which is really exciting. He also just published a book, so immediately following this talk, you'll have an opportunity to buy the book, and he will sign it. And it is called After Cancer Care. And so this book gives a lot of practical information about what can you do to prevent recurrence, to improve your quality of life, what can your kids do. And I know this is a question that everybody wants to know more about, and I think he has a lot to tell us. So, and it was just published this August, so you're kind of getting it hot off the presses. So let's bring Dr. Mehta up and welcome him.
Thank you. Thank you. All right. Can everyone, I don't know if the mic is on. Can everyone hear me okay? Okay, so I don't need to stand here. So I wanted to talk about this idea of control and controlling what you can after diagnosis of breast cancer. I know that, can you hear me? Okay. So obviously there are a lot of issues after a diagnosis of breast cancer, and one of the major ones is this idea that you lose control, and you want to find the things that you can get back. And that's was the impetus behind my book and the impetus behind this talk. So many of you in the room have had this moment where you were told you have cancer, and obviously a devastating moment. There are 13 million cancer survivors today, and that number is thankfully rapidly going up. In 2020, they're predicting about 20 million. So each survivor is faced nowadays, as the treatments are getting more and more complicated and unique to each patient, each survivor is facing their own share of issues, physical issues, psychosocial issues, even financial issues. In the current era of cancer care, treatments are getting expensive, and sometimes the financial issues alone are overwhelming. So as I said, sometimes you do everything right, but cancer happens, you lose control. These are some of the things you can do to gain that control back. You can ask questions, become knowledgeable about your disease. You can seek support from family, from friends. But what I'll be talking about are those last three issues here, which is how to feed your body, how to stay active, and how to manage stress, which sometimes is easier said than done. But I want to mention briefly about this integrative medicine. So integrative medicine, it's a topic that has recently been getting some attention. Integrative medicine is part of what I do. I'm a medical oncologist who does breast cancer, but I'm also the head of the Integrative Oncology Center, or new Integrative Oncology Center at my institution. So this, I think, is a nice summary of integrative medicine. Hippocrates, a long time ago, said it's more important to know what sort of a person has a disease than what sort of a disease has a person. So it's this idea of the seed and the soil. So integrative medicine focuses on both. And about 17 years ago, the National Institutes of Health established the first integrative center, which was called the National Center for Complementary and Alternative Medicine. And then the word alternative became associated with some unusual practices. So we took alternative out of the equation, and it's now known as the National Center for Complementary and Integrative Health. Alternative, in my mind, is something you do in lieu of standard treatment, which is not what I'm recommending. And integrative medicine combines mainstream medical therapies and complementary therapies for which there is high-quality scientific evidence of safety and effectiveness. I think this is what some of the docs in my hospital think when I walk in. I think I do have a mask like that somewhere in the back. Just some examples of integrative medicine. You'll see here some things that you may not recognize, like Reiki, traditional Chinese medicine, but you'll also see resistance exercise, aerobic exercise, nutrition. So it incorporates all of this. In case you came here to see this kind of survivor, this is not the, yeah. Although I enjoy both. But obviously, these are the sorts of survivors that we're going to talk about here, many of you in the room. This is a conversation that many medical oncologists have with their patients. We finish treatment, and as an oncologist, you feel great that you were able to get a patient through treatment. Congratulations, you're done. And then there's the inevitable, that's wonderful, but what do I do now? And unfortunately, even today, the recommendations that we have are somewhat vague, which is if you have any symptoms, or if you don't feel right, just call me. Otherwise, I'll see you in 3 to 6 months. And I'm sure many of you have gotten this same thing. Sometimes the oncologist will go the little extra mile and say, well, eat healthy and exercise. Sort of vague recommendations. I mean, imagine if you were to give those recommendations at diagnosis. Get some chemo and radiation, and you'll be fine. So Mrs. Smith, obviously, is there anything I can do to prevent this from happening again? Because what happens is this is how patients feel. And I'm sure many of you have felt this. You're in the cocoon of cancer treatment. You're seeing the docs, you're seeing the nurses, you're coming every week, every other week, and you feel protected as part of the system. But then there's a drop off the cliff that happens when you're done. And it is scary. And so you feel like you really are out there in the wide open air. So the program that I'm trying to build at our cancer center and what some of the larger academic cancer centers have already done is an integrative program that talks about lifestyle. And when I look at lifestyle changes, these are the 3 pillars of lifestyle modification in my mind. There's nutrition, there's physical activity, and there's stress modification. So, and I say physical activity because I think exercise sometimes is a scary word. So it's really just about being active, and I'm going to talk about all that. So, you know, there's obviously limitations that you have when you come through treatment. Sometimes you physically can't do things. Sometimes emotionally you're not ready for things. But I also want to, I put this up because there's a difference between limitations and excuses. And I think we internally have to recognize those differences. This is not my client, but I was a personal trainer. I was a personal trainer before I was a physician. And actually, my oldest client was an 88-year-old woman whose husband had passed away, and they used to swim together all the time. Very active. She did not look 88, but one thing she'd never done, her husband wanted her to do, was lift weights. And I taught her how to lift weights at 88, and she was unbelievable. So we're going to start with this idea of nutrition. So, cancer nutrition. What sort of recommendations can we make? Up until about 2 years ago, the National Comprehensive Cancer Network, or the NCCN, which is the body, it's composed of about 26 large academic centers that meet often and come up with guidelines for treatment. And the breast cancer guidelines are the largest of all of the cancer guidelines. They're about 265 pages now, maybe even more on the updated version. In the original guidelines, there was a paragraph that talked about eating healthy and exercising in the entire guidelines. In 2013, the NCCN decided to establish survivorship guidelines for the first time. So in 2015, they were just updated. And I'm going to go over just some of the stuff I'm talking about today actually is a reflection of the NCCN guidelines, but I'll go a little more in depth into it. So when we talk about nutrition and cancer, I think no talk about nutrition is complete without understanding the nutrition label and some of the some of the myths and ways in which companies can fool you. So this idea of serving size, let me see if I can, here we go, okay. So serving size and calories per serving. So just remember that you often have several servings in your box or container. This is a sugary popcorn of some sort. So there's 3 servings, 140 each, so you really are getting 460 calories in that bag. You then look at fats. Trans fats, I don't know if you've heard recently, the FDA has now mandated that all food manufacturers remove trans fats from the food supply in 3 years. So this is something that's been known about by the food manufacturers for a little while, the dangers of trans fats. Right now, though, over the next 3 years, if you see 0, there's actually trans fats in there. If it's less than 0.5 grams, they can say 0. So the fact that it's here tells you there's trans fats in here. So again, multiply by the 3.3. I'm going to talk a little about carbs, fiber, and sugar here, but again, understand that the carbs are broken down into complex carbohydrates and simple sugars. And then finally, the ingredients. The ingredients are listed in order of most to least. So if you can see here, sugar is the #1 ingredient here. So let's start with some of the basics that I talk to patients about. What I'll do often is patients are done with treatment, and rather than see them back in 3 months, I'll see them back in about a month and tell them that we're not going to talk about the cancer. We're going to talk about this lifestyle. So as part of this long discussion, we talk about my rules, my basic rules. So the first rule for me, breakfast. Breakfast is tough. In the mornings, with work and the kids and life, we often don't get a good breakfast. But breakfast is the most important meal of the day. If you think about it, for 10 hours or so, you haven't eaten anything. Now, your metabolic rate is not very high at sleeping, but you are fasting. That's why it's called breaking a fast. So you want to make sure you get adequate amounts of these things. So my recommendation for the average person is about 7 to 10 grams of fiber, 10 to 15 grams of protein. You really want to limit refined sugars in your breakfast. And this has to do, and I'll go over this in a little bit when I get to the carb section, but it has to do with insulin and the dangers of chronically elevated insulin. Unfortunately, the standard American breakfast often is a white bagel, muffins, donuts, et cetera, which are really the worst things you can eat, particularly in the morning. You need to sort of prime your body for the rest of the day. And this is why breakfast should be a big meal with fiber and protein. The same applies to snacks, also has to do with insulin. Every 3 to 4 hours, what happens is if you go about 4 hours without eating anything, the way your body uses energy, for the first few hours you're actually using glucose for energy. After about 3-4 hours, it shifts to amino acids, which are in muscle. So if you think about what happens when you go too long without eating, you're actually taking energy from muscle, which, especially if you're exercising and trying to maintain your metabolism, is not the right thing to do. So every 3 to 4 hours, have something. And this idea of healthy snacks, making a list of healthy snacks, you don't want to spend hours doing this stuff, but have in your head or just written down somewhere about 5 or 6 things that you like, that you know are healthy, that have a little bit of fiber, have a little bit of protein. Just some examples here: Greek yogurt, almonds, peanut butter, an apple. I mean, you can pick a few different things, but if you don't have it in your head, you're going to grab the first thing that's nearby at work or at home. But if you know what you're going to be eating, it's a lot easier to eat it. And then this idea of not eating too late and taking a hike, as in taking a walk. They say that there's an old adage of after lunch, rest a while, after dinner, walk a mile. If you think about what happens after breakfast, you're actually up and about. So even if you have a big breakfast, you're using those calories. After dinner, for most of us, we sit on the sofa and we go to bed. So those calories are not used. And calories that aren't used go into the liver, and some of them get converted to fatty acids, which you don't want. So the ideal time is about 3 hours before you go to bed, if you can help it. you don't want to go to bed really hungry. You don't want to go to bed full. And then the question, I guess I like the dwarves. The question of why do we eat? We eat because we want to stay healthy. We eat because we're hungry. But often we eat because of lots of other reasons. There's a great book called The Power of Habit, which I don't know if anyone's read, but it goes into why we form habits and the reasons behind it. And often, and they have a whole section on food, but often we eat for some of these reasons. I always mention these 4 food groups. These, to me, are the 4 food groups of a plant-based diet. That does not mean you need to be a vegetarian by any means, but you should have a plant-based, the majority of your food should be plant-based, and the NCCN does endorse this. So these are the 4 food groups. They're whole grains, nuts, seeds, and legumes, veggies, and fruits. And you want to try to get something every day from these groups if possible. Meats are a big source of controversy. So you want to avoid these processed meats. They have nitrites often. These are polycyclic aromatic hydrocarbons, which are also not good for you. Red meat's an interesting one for breast cancer. So we've always known there was a connection, but over the last couple of years, data has made that connection a little tighter with red meat. So there was, they've looked at some of the data from the Women's Health Initiative, which is that large study that was able to give us a lot of information about women's health and breast cancer. Interestingly, they found that red meat, more than 1 to 1.5 servings a day of red meat increases your breast cancer risk by about 25%. What's interesting is that survey included all of it. So if you have a bacon, egg, and cheese in the morning and a ham and cheese for lunch, they actually counted all that as part. So it's not just having a steak every day as part of the red meat. They've actually done studies on young women, for those who have daughters, from the ages of about 11 to in their early 20s. Breast tissue is exquisitely sensitive to carcinogens. And the same study was looked at in terms of the red meat intake for younger women, and the same, even higher numbers were found of ultimately developing a premenopausal breast cancer in women who had high amounts of red meat in their youth. So just something to mention to your daughters. Sugar, again, something that comes up a lot. There is this myth that's been pervasive for decades. Sugar feeds cancer. It's not that sugar feeds cancer. What happens is a lot more complicated. Sugar, when you have refined sugar, what happens is your body, your pancreas, secretes insulin. And insulin is an important hormone to drive the sugar back into cells. But over time, with refined sugar, with diets that are high in saturated fat, you develop what's called insulin resistance. So your pancreas needs to secrete more and more insulin to get the same effect. It's been shown in several trials over the years that chronically high insulin levels are associated with several different cancers, but there is a link with breast cancer. So insulin and breast cancer, insulin's sort of the bad guy or bad girl in higher amounts. Insulin also seems to promote an increase in something called IGF-1. IGF-1 is insulin-like growth factor. IGF-1 is so important in breast cancer that in phase 2 clinical trials right now, there are IGF-1 inhibitors that are looking promising. So high insulin, high IGF-1, not good. You want to opt for some of the more natural sugars, although there's controversy about what's natural, what's not, but those are some options there. And this is actually a good website. It's called glycemicindex.com. The glycemic index is the amount that any specific food will raise your blood sugar. There's also something called a glycemic load, which factors in the total carbohydrates. But the idea is you want to have foods that are lower on the glycemic index scale. So the foods that I mentioned earlier, these lower glycemic, these higher glycemic. And some that you would be surprised, like the potato, maybe you're not surprised, but a white potato is really high on the glycemic index scale. It's actually, out of 0 to 100, I think it's in the high 80s. So good to check out the website. But white bread, white pasta, white rice, white potato, convert it to brown. What about alcohol? So a couple of years ago at the San Antonio Breast Cancer Conference, there was a presentation that really kind of started this whole idea about alcohol and breast cancer. And a follow-up 1 million women study in the UK demonstrated that for every serving of alcohol increase per day, there was a 12% increased risk of breast cancer. A serving, which is about 10 to 14 grams, is 12 ounces of beer, 4 to 5 ounces of wine, and a shot of liquor. So the current recommendations are no more than a few a week. It's kind of hard to give specific numbers, but the study that was originally done said half a serving a day at most of alcohol. So 3 to 4 drinks a week is what I'm recommending for those who do want to drink. And this probably causes some of the most controversies, this idea of organic. What is organic? How do you know something's organic? It is evolving. There are different USDA labels for organic. If something truly says 100%, it's a USDA label that'll say USDA 100% organic, then all the ingredients in that food are organic. If it says made with organic, the cutoff is about 70%, so 30% of the foods don't have to be organic. This, I think, is a great little list that's compiled by an organization called the Environmental Working Group. So what they do is every year, they test all major produce, fruits, vegetables, for pesticide. And they actually wash the fruits the way you would, they really wash it well under in the sink and clean it off exactly the way you would to see how much of the pesticide would be left. And every year they come up with this list. So this year's 2015 list, these are the foods with the most pesticides right here. And it's foods that we all eat very often, unfortunately. So if you are thinking about organic is more expensive, unfortunately. Shouldn't be, but it is. In Austria and Denmark, the farmers get subsidies for growing organic. And then the inspectors go there, and if they find that it's not organic, they have to pay the subsidies back. Simple things that we could do here. So this leads into this issue of GMOs I just want to mention, because I know that's also a hot topic. What are GMOs? And so GMOs, genetically modified organisms. GMOs, the main purpose of GMOs was to change the genetic structure of the organism. Corn and soybean are the two big GMO crops in this country, is to change the genetic structure to make them resistant to pesticides. So you could spray the entire field with high amounts of pesticide, and unfortunately the numbers are going up because the weeds that you want to kill are becoming resistant to the pesticides. So now you need more and more. This year, in 2015, about 3 months ago, the International Association for Cancer Research just came out with the fact that the main pesticide in all of our in all the crops, which is Roundup or glyphosate, is now a probable human carcinogen. So we're spraying the fields with a probable human carcinogen in high amounts, and the majority of the public is eating it. So just some takeaways. Eat whole foods, not processed foods, if possible. Foods were not meant to last a year or two on your shelf. It's even my little daughter knows that. Spice it up. Instead of salt, sugar, there's lots of interesting spices out there. Learn to use some of them. Stick with it. This is a big one. It takes a little while to get used to some of the change in habits. It takes about 4 to 6 weeks to make a real habit change. And prepare this idea that every week, maybe on a Sunday or so, just think about what you're going to be eating through that week. If you really want to make lists, and that's great. But just have a little idea of what you're going to be doing and learn how to shop and cook. Eat more often, and particularly as mothers, you're often the head of the household, in my mind. I know my wife is the head of the household. No doubt about that. But you're setting an example. And you're setting an example. So it's actually been shown that when women make a change, when a mother makes a change, the whole family is much more likely to make that change. And that's true internationally. I'm not going to talk too much about supplements and botanical, but just a word about it. The NCCIH has now established an Office for Natural Products Research. So for the first time, the government will be funding natural products research. But despite occasional anecdotal evidence and stories, there is no magical supplement that cures cancer. If there was, everyone would know about it. I want to mention a couple of these, though, that I do talk to patients about. Vitamin D, at this point, is not really considered even complementary. I almost look at that as a standard treatment in breast cancer. Keeping your levels between 40 and 60 is recommended. This estimate here, even if it's a quarter of this number, it's such a simple thing that you can do to decrease risk. And my recommendation is 15 minutes of sunshine is okay. You know, people have listened about the skin cancer risk, and there's been a lot of sunscreen, and unfortunately it's led to vitamin D deficiency. Vitamin D is synthesized in your body through sun exposure. So, and the other way you can get it is by taking a supplement, or it's in certain foods. Omega-3 fatty acids, these are important for some certain side effects of treatment. For example, women on the aromatase inhibitors who get joint pains, omega-3 fatty acids, recent studies showed that they actually alleviate joint pains, but they have other health benefits. Turmeric, curcumin, which is the active ingredient in turmeric, has over 1,000 studies looking at its benefits in cancer. The NCI is looking at turmeric right now for its anti-cancer properties. And then some of these other supplements. Physical activity. I can't tell you how many times I would see this. We had a 5-floor gym, and there would be a line at the elevator waiting to get to the Stairmaster. You know, this is, unfortunately, and the idea being, this is a more profound statement that it's about lifestyle. It's not about going to the gym. This is my A to Z. Took me a while to compile it. P, by the way, is the longest word in the English language. Exercise has no benefits, but I just wanted to put it in there because I thought it was such a cool thing to put. But you can't talk about exercise without talking about obesity. It is the greatest risk factor it is becoming the greatest risk factor for death in this country, approaching tobacco as less people are smoking, and obesity is an epidemic. It's becoming a real issue. How do you define obesity? So the US defines it with these parameters. About 15 years ago, about 30 million people became overweight when the guidelines changed. So it used to be that 27.5 was considered overweight, and then it went down to 25. So some of the increase in the numbers in overweight numbers is because of that. But if you look at other countries, particularly some of the Asian countries, the cutoff is 22.5 or 23. That would make probably about 85% of our population overweight if we use their guidelines. And then obese, these are the 3 classes. In fact, the US has some of the highest thresholds. Most countries' thresholds are even lower than this. And lest we think it's just a problem in the US, it is an international health crisis. As developing nations are adopting the Western diet, they're adopting a lot of American ways, but unfortunately they're adopting the Western diet, and now they're having to deal with this issue of malnutrition and obesity, which really is a public health crisis. And America wins again. We're at the top. The most obese. Actually, the most obese nation in the world is a small Pacific Island nation where everyone genetically is about 80% of the population is obese. It's called Nauru. So I didn't include that in here. This is one of those crazy slides looking at all the different pathways. But point is that obesity and cancer, we're not sure what the connections are, but we know there are connections. There's connections with inflammation. There's connections with insulin resistance, and then some of these other hormone pathways that lead to increase in proliferation of cells and survival of cells that shouldn't survive. But it's complicated, and finally there's some real attention being paid to it. So how do you lose weight? Well, it's obviously not a simple task. But when you look at, from an energy standpoint, 1 pound is 3,500 calories. Now, everyone's different in terms of their metabolism, in terms of the medications they're taking, but if that's the case, if you know what the number of calories you would need in a given day to maintain your weight, which you can calculate, and you drop your intake by 200 a day, drop your intake by 300 and up your expenditure by 200, you've now created a 500 calorie deficit, which over 7 days is 1 pound. Now, the math is not perfect for everyone, but from an energy expenditure standpoint, this is part of it, which is why, diet and exercise help you lose weight. It has to do with the math. By the way, 200 calories a day of usage, if you work in an office and you sit all day in your office, and for 5 days a week, for 8 hours a day you sit, and instead you get a standing desk, and you were to stand every day, 5 days a week, you would burn an additional 250 calories a day doing nothing else, which could translate into 40 pounds, 30 to 40 pounds a year, if you did nothing else. So for everyone sitting here, maybe we should have a, let's stand up. And it is a myth that you can't lose more than 10%. Don't believe the hype. You can lose more than 10%, and you can keep it off. So exercise is any activity that requires physical effort. And it can be those crazy triathletes, which I still am amazed that people do that stuff. Or it can be a walk. It just depends on your own level of fitness. And the American Cancer Society has added regular physical activity to its list of measures as its core measures now for cancer, and that was about almost 20 years ago, and said we can prevent lots of breast and colon cancer if we become more active as a nation. And what about its role in cancer? So we know it works in decreasing obesity. We know that the benefits do extend beyond weight loss, stress, inflammation, and again, this issue of body image. Exercise will help improve body image. A study looked at walking, 18% reduction in the risk of getting a breast cancer. This was a primary prevention study, women who had never had breast cancer, but 75 to 150 minutes a week. So that's, if you do 15 minutes a day, 5 days a week, that actually has some real benefits. This is a real term, by the way, for all of us sitting right now. The sitting disease was 125,000 healthy volunteers were looked at and examined for how much they sit in their job or during the day. Sitting more than 6 hours a day increased the risk of death in women twofold. And a lot of that was heart disease, and some of that was cancer. And what's interesting about this study is it was even women who exercised. So if you sit all day and then decide to go to the gym 3 times a week, the exercise didn't neutralize the effect of the sitting. So stand up. And the idea is these are simple tips. Like I said, it's about a lifestyle change. Going to a gym and working out is great if that's what you enjoy. But it's the little things that really do add up to real health benefits. A study looked at taking the stairs 3 times a day, 3 flights, 3 times a day. Over the course of a year, you could lose 10 pounds without doing anything else differently. Walk when you're on the phone, stand up, and then this idea of not beating yourself up. This is a big one when it comes to exercise. Most people start, and then they have huge expectations, and they don't meet them, and they stop. Don't beat yourself up. You fall off the wagon, get right back on it. Even what I tell patients is think of it like a 5 to 10 minute activity. You can always do 5 to 10 minutes. Do that, do it twice a week. For people who've never exercised, 5 to 10 minutes twice a week. And do that for a month. And it's amazing how it's just these little changes in your habits can really add up. And these are just the 3 types of cardiovascular, flexibility, strength training. This is an important one in my mind for women, particularly postmenopausal women with breast cancer. Bone density tends to be a big issue. whether you've gotten chemotherapy, whether you're on an aromatase inhibitor, your bones do get weaker. There is no better way to improve your bone health than resistance exercise. You can take some of you may be on Prolia and Fosamax and some of these other drugs. Exercise far outstrips those drugs in terms of bone density benefit if you are able to go on a regimented program. And resistance exercise can be bands, it can be little weights, it can be anything where you're pushing and pulling against a resistance. So that's an important one in my mind. There's yoga. That is not Photoshop. She apparently, this is a woman. There's a lot of interesting photos about this woman that does. So yoga has all sorts of benefits, both mental and physical, flexibility, strength. There's a website, I think it's called yogatrail.com. There's so many types of yoga out there that it's hard to figure out which one you're supposed to do. The hot, the cold, the lukewarm. I don't know. There's so many types. So there is a website. There's a few websites out there that do help you figure out and find the one that would work best for you. And then finally, stress. Stress is a tough thing to define. You know, it's like Justice, I think it was Justice Souter said about pornography in the 70s. You know it when you see it. You know, and stress is there's so many biochemical and physical things happening when you're stressed. But we do know stress is not good from a breast cancer and cancer standpoint. They gave a whole bunch of mice breast cancer, and then they put half of them into a small cage, and that was simulating stress. What they found is that there was a 30-fold higher rate of metastasis of breast cancer cells in the stressed mice versus the non-stressed mice. So these are obviously lab studies, but interesting nonetheless. And Ohio State researchers looked at breast cancer survivors and found that the ones who were in an active stress reduction intervention had a 45% reduction in risk of recurrence, 60% reduction in risk of dying from breast cancer. Now, obviously, the stress reduction alone wasn't the main reason, but even if, again, those numbers are half, a very simple thing to do to try and offset risk. And cancer and treatment lead to a litany of stress: physical, emotional, financial, spiritual. For a lot of breast cancer patients, there's hormonal stress, and my favorite slide of the. So this is it. Yeah, this is the one. So there may be many in the room that that experience this, but yeah, right. So, but I mean, we're being facetious, but obviously, the symptoms associated with treatment from breast cancer for a 33-year-old woman who I've put into menopause because of chemotherapy, this may not be that funny, because for her, the relationships, sleep, her ability to care for family, to work, all of it's affected every moment of the day. I want to mention this mindfulness-based stress reduction. It was developed by a doc at University of Massachusetts, John Kabat-Zinn, a long time ago, in the 70s. Brings together mindfulness and yoga, essentially. So mindfulness is really about paying attention to your environment and paying attention to yourself. And it sounds like it's such a simple thing, but if you actually learn how to practice it, the other day I was in, they say traffic is a good time to try and do it. So I'm sitting in traffic, and the guy cuts me off to try to get that extra 4 feet ahead. And I said, all right, I was about to kind of honk, and I just took a second and said, well, why do I, what am I doing? And it just took like 2 minutes, and it quickly calmed me down. It was interesting. I need to practice it more with my kids. That's the trick. But it has been shown to improve quality of life and mood and diminish distress in cancer patients. There are lots of other strategies. Qigong is like a Tai Chi in some ways. Physical posture, breathing, mental focus, and then a whole bunch of other stress reduction techniques that many integrative programs will have, many integrative cancer programs will have. I just want to mention a couple of things about a couple of symptoms that come up a lot. Neuropathy. Many of you who have gotten chemotherapy may have experienced this or are still experiencing it sometimes years later. Just, I want to mention this because you don't want to assume that it's always the chemo. It can be other things that come up. These are some supplements that have shown benefit in smaller trials. Unfortunately, there are not big randomized trials. We actually, at MD Anderson, now we have a protocol that we give for any woman who is about to start a neuropathic-inducing chemotherapy like a taxane or some other drugs. So acupuncture has been shown to help. Even these cold caps in some studies have been shown to be helpful because it decreases blood flow to the nerves. Fatigue, that is ubiquitous. Every patient I've seen has fatigue, unfortunately, from, again, the myriad of the chemo, the radiation, the hormonal changes, all of it. But again, make sure that it's not that. Make sure it's not your thyroid. It's not these things. There are so many women that are iron deficient that don't know it. And this is my plug for IV iron. So just ask your doctor to check these things. And then nausea. We do use ginger as part of our chemotherapy protocol for women. I mean, we give them aggressive anti-nausea medicine as well. So this is just to say that times can change. It really is a call to action for cancer centers, for patients. I mean, it was in the 80s that doctors were smoking on rounds. You know, I'm sure we all remember when you could smoke on an airplane. You know, this is great because the Blatz beer that she drinks, all the health benefits will go to her little one. So we can change the way we think about all of this. And I think many of you here, this statement is appropriate. You're here because you want more information, and you've taken these proactive steps to get control back that you've lost. So I think for all of you, cancer didn't bring you to your knees. It did bring you to your feet. So that's that. Thank you.
Okay. I will walk to the stage. So, is it on? Okay. I think we could take one or two questions before the book signing. I just want to say it's so frustrating, those dirty 12 fruits. It doesn't matter if you peel them. I always thought
yes, I didn't mention that. That's right.
It was okay.
That's right.
All right, I'm coming to you. This is my exercise.
Hi, can you comment on the benefits of green tea? I know a lot's been said about that related to breast cancer.
Yeah. So we're not sure exactly why green tea seems to be helpful, and there has to be a certain amount of it, and 3 to 4 cups. So you do need at least 3 to 4 cups to get some benefit. There seem to be antioxidant properties to green tea, and there seem to be anti-inflammatory properties to green tea. So, and green tea has been shown to be useful not even just for cancer, but lots of other chronic diseases. In the breast cancer world, again, the studies tend to be smaller, and there are not yet, although they're coming, randomized trials telling people to do this. They're really survey-based. So the problem with some of that is people who drink green tea often have other healthy lifestyle changes. So it's sometimes difficult to interpret some of the data, but green tea does seem to be helpful for those reasons.
There's a question over here.
Thank you for your great presentation.
Sure.
I just wanted to know, tell us a little bit more about your book. Why should we buy it?
Because I have
Did you plan?
all
Was that
three
a
of
plan?
yeah, I know. All 3 of my kids are in private school, and I need the money. Is that good enough? Okay. No, I mean, you know, the impetus behind it was what I said, which is that patients, there's just not anything out there for patients once they are done with treatment. And we need to have more cohesive guidelines, real practical information we can give people that's evidence-based. Because what's happening, and I'm sure a lot of you have done, is that the internet is just so vast, and you can just find anything. You can find anything to support any hypothesis on the internet. And so I have patients that'll come in, and they'll give me their list of, you know, different supplements, and whatever that they're on, and there's no evidence behind a lot of those things. So the idea behind the book was really give evidence-based recommendations for this after cancer care, with the caveat that you should really talk to your oncologist, that they're comfortable with it. For the question that comes up is, what about doing these things during treatment? Now, I'm a believer that lifestyle changes during treatment are helpful, but the reason that we decided not to focus on that is that in the conventional oncology community, of which I'm a part, absolutely, there is a reluctance to think about doing anything that could interfere with treatment, radiation, chemo, even though there's no data to support that. It's just this hypothetical risk, and so they don't take it. I think that there's studies coming out over the next couple of years that are going to hopefully change some of that.
All right, we're going to take one more question. Did you have a question?
Regarding integrative and complementary medicine, is there one or several types of tests that you can give to your patients to measure certain levels of vitamin deficiency? Of course, iron is through blood, hormones. And do you, at one point, once you've gone through your treatment and you're on the other end, recommend that so that you can continue to do whatever supplementary might be beneficial, targeted beneficial? And I have a second question, if I may, really quick. Regarding these fruits and vegetables, are you aware of any specific way to properly maybe clean them of these pesticides as well?
So let me answer the second question first, which is that a lot of these pesticides, and the Environmental Working Group has examined this, like Jean said, when you take the skin off, the pesticides have penetrated in. Glyphosate has an ability to penetrate through, bananas, oranges, not so much. Apples, in the flesh of the apple, there's the pesticide. So unfortunately, you can't wash away pesticides like you can dirt or bacteria. And people on chemotherapy, I'm sure they've given your recommendations about washing your fruits and vegetables, which again is more for the bacteria piece of it. In terms of the testing, so this is a little controversial about, there's lots of companies that offer these, big panels of vitamin testing, and the way I sort of look at it is just because we know how to test doesn't mean we know what to do with the results just yet. So I don't use from a broad standpoint. I mean, like I said, for specific things, iron deficiency I think is rampant. B12 and folic acid deficiency, B12 particularly, can be fairly common. Even the current thresholds I think are too low. There's a lot of B12 deficiency out there. But checking a lot of other vitamins outside of vitamin D, there's just not enough data that a deficiency or what we classify as a deficiency really impacts the cancer treatment. And remember, even a deficiency is just, those numbers came from somewhere. So those are someone just decided, or some company decided, these are the numbers that we're going to call deficient. But how do we know that that's, I think there's just not enough control around it yet. There are integrative practitioners that the Society of Integrative Oncology and the Integrative Medicine societies, if you go on their website, you can get I am board certified in integrative medicine, but there's folks who just do integrative medicine who, if you can talk to your oncologist, some of them will have relationships or at least know people who they trust who can do some of that testing. We can do testing now in a drop of blood. One drop can get you all sorts of interesting information. I don't think it's ready for prime time yet.
Okay, thank you so much.
Sure.
We're going to let...
Thank you. All right.
So Dr. Mehta will be out front with his books and signing. He'll also be doing a webinar for us. Isn't that right? I think he is, but you'll get an email. So more on that to come. Thank you so much, and take a little bit of time maybe to go outside. I think it's sunny.